హాయ్ ఫోక్స్, వెల్కమ్ టు మై ఛానల్ ది యావరేజ్ డర్మాడాక్. ఇక మొదలెడదామా?
Slit skin smear. Most useful and commonly utilized laboratory diagnostic method for diagnosis of leprosy. To diagnose leprosy, we have to have two cardinal signs out of three. What are those cardinal signs? First one, definite loss of sensation in a pale or reddish skin patch. Complete loss, definite loss of sensation. Next, peripheral nerve enlargement or tenderness with loss of sensation and weakness of the muscle to which that nerve supplies. Whichever nerve is affected, either it has to enlarge or become tender with loss of sensation or weakness of the muscles to which that nerve supplies. Third cardinal sign, positive slit skin smear. To understand indications of slit skin smear, I am telling all these three cardinal signs of leprosy. What are the indications of slit skin smear? Diffuse skin infiltration, first one. Numerous bilaterally symmetrical ill-defined macules, papules, plaques, nodules over earlobe, face, trunk, back, extensor aspect of the limbs. If patient presents with all these lesions, we will check sensations over that lesions. Then if there is no loss of sensation, if sensations are absolutely fine without loss of sensation, or there is just vague sensory impairment, we will come to first cardinal sign. There should be definite loss of sensation. Here, to fulfill the first sign, loss of sensation is not there. So we will go to a laboratory test. We will take help of slit skin smear here. These three are indications. Next, whether the patient is suffering from multibacillary disease or paucibacillary disease, it is unclear. We will take help of slit skin smear again here. At the time of release from treatment, RFT, not renal function test, release from treatment, for all multibacillary patients, we will take slit skin smear for the diagnosis of relapse, if at all it occurs in future. If in future any multibacillary patient develops new lesions, fresh lesions, it may be due to relapse or reaction. To differentiate that, we have to do slit skin smear. If a patient is suffering from chronic granulomatous lesion, we are in diagnostic difficulty whether it is leprosy or not, then we will take the help of slit skin smear. If a patient presents with typical lesions but there is no sensory impairment or vague sensory impairment, whether there is unclear between multibacillary disease or paucibacillary disease, reaction or relapse, any chronic granulomatous lesions where there is diagnostic difficulty, for all this we will do slit skin smear and we will confirm whether it is leprosy or not. Now we will see the role of slit skin smear. When we are having any difficulty in diagnosing, we will do slit skin smear to confirm the disease, leprosy or not. Next, to classify the disease, whether it is multibacillary or paucibacillary, whether it is relapse or reaction. To determine disease activity, to assess progress of the disease, to follow up the patient while on treatment. We will do serial slit skin smears while the patient is on treatment to know whether patient is responding to treatment or he developed any resistance for the treatment, whether to change drugs or not, whether to continue the treatment or not. Sites from where we will take slit skin smear according to ILEP, just two sites, one earlobe, one most active lesion. No most active lesion was present, then we will do slit skin smear over another earlobe or sites where previously lesions was present or site where previously slit skin smear came as positive. If no active lesion, we will take smear from another earlobe or site where previous lesions were present or sites where previously slit skin smear came as positive. 2 sites ILEP. According to WHO 3-letter word, 3 sites. Minimum 3 sites. 1 earlobe, just like ILEP. 2 active lesions. If only 1 active lesion is present, 2 smears from opposite active edges. If only 1 lesion is present, total 3 sites. Now coming to materials required. Surgical mask, most important. Surgical mask for both doctor and patient. Why? Leprosy spreads through nasal droplets. If a patient sneezes, leprobacilli will spread through air droplets up to 30 to 50 centimeters. To be safe while dealing with patients. Next, disposable surgical glove. Cotton swabs soaked in alcohol or methyl alcohol or spirit. Number 15, blade, microscopic glass slide to make smear and examine in microscope. Tincture, benzoin. Procedure. After taking consent and counseling the patient well fully about the procedure, then we will go for procedure. First, clean the skin site where we are going to take slit skin smear using cotton swab soaked in methyl alcohol and allow the area to become dry. Leave it for some time to become dry. Then using non-dominant hand, thumb and index finger, pinch the fold of skin, tightly pinch the fold of skin. Why? To drive out the blood until it blanches. Till it blanches, we have to hold. Then using number 15 blade, make a cut 5 mm long and 2 mm deep with pressure on the fingers being maintained without releasing thumb and index finger of non-dominant hand to avoid bleeding. If there is bleeding by any chance, wipe off the blood with a sterile swab to avoid contamination of the smear with blood. Then the blade is turned at right angles to the cut and the wound is scraped several times in the same direction so that the tissue fluid and pulp, not blood, only tissue fluid and pulp collects on one side of the blade. Then all those material was gently smeared onto a sterile glass slide. Now seal the wound. Release the pressure with non-dominant hand. Seal the wound with cotton wool dipped in tincture benzoin. Allow the smear to dry at room temperature. And fix the smear onto the glass slide by moving the glass slide briefly over a flame. If we keep over a flame for too much time, bacilli may get destroyed. So just briefly over a flame to fix. And now the glass slide is ready. And now the smear is ready for staining. Precautions. What all precautions we have to take? The sites from where we took smears are recorded. For what? So that the same sites can be used successive sets of smear during the course of treatment. Already I told you from where we have to take smear. If there is no active lesion from the sites where previously active lesion was present, how come we will know? By recording the sites from where we are taking lesions. Once used, the slide should never be used again. Slides should not get exposed to sunlight, dust, extremes of temperature, humidity, and should not be stored for a long time. All these factors interferes with staining. Leprobacilli, while taking carbol first in stain during staining procedure, all these factors will hinder the staining procedure. Remember my channel name, The Average Dermadoc. Don't forget to like, share and subscribe. Thank you. Hasta la vista. Desvidania.